Hi, everybody. I'm Dr. Craig Bax. I'm the founder and chief medical officer of the Cure Center for Chronic Disease in Springfield, Illinois. And from time to time, we like to talk with some of our current patients about their experience at the Cure Center as we strive to reduce the impact of heart attack and stroke by reversing cardiometabolic disease, meaning arterial disease and type 2 diabetes. And it's my pleasure to have a conversation today with Tony Williams. Tony is also a good friend, but has been a patient in the Cure Center and has been working on his cure plan for a few years now. And he's been kind enough to agree to join and share some of his thoughts about his experience so that perhaps others can feel more comfortable from that conversation. So Tony, welcome. I appreciate you joining me.
Hey, I'm glad to be here, Doctor. Um, it's good to be able to talk about my journey with you, so to speak.
So before we go into that, just tell the audience who are you and what have you been up to?
Well, even though I'm retired, I worked for Department of Corrections probably for 26 years. Was the director of the training academy. Retired. Thought I was going to retire, and high school in my hometown asked me to be the assistant dean of students, so I did that 12 and a half years, and I was on a city council, and I'm one of those people that stay busy. I'm a Rotarian, so I get the opportunity also to give back to the community. And now I kind of in a lull in a sense that I've only got a few jobs as a retired person, so I work for the Illinois Senate as the doorkeeper. And I'm a grandfather, and I've been married for 28 years, and so life is really good, really good.
So to put it simply, he's a good guy and well worth saving. Does a lot for his family and his community, and but sometimes, like so many people who give so much to their families and community, often forget that it's important to keep the oxygen mask on yourself, and that we're not much use to others if we ourselves are not taking care of ourselves. So, I guess you and I probably first got introduced through Rotary personally, and then you came to see me. Now you probably remember a little bit more about that than I do. So let's walk us through what your experience was getting started, what it's been like moving forward, and then we'll kind of go from there.
Well, I've been with you for almost 6 years to be. I lived in Jacksonville at the time, in my hometown, and I used to travel over here to see you. My wife had heard you in Morning Rotary, Sunrise Rotary, and she was talking about the fact that you were able to scan our arteries and kind of tell more about ourselves as far as our health went. I've always been kind of health conscious to a certain degree, even though I hadn't always been mindful. But the problem was I always found that I was going to doctors and they were trying to tell me this what was wrong, what the problem was, but I never knew what the cause of the problem was. And so my wife, being more of a holistic type person, she said, I think that you should go see Dr. Bax so he can give you a full body scan to find out why you have high blood pressure or why your cholesterol is high or whatever that is that I wasn't getting answers to. And so that's when I first met you, and I got an appointment with you, and so you started talking to me about the path to recovery as far as healing again.
Well, I think at the time, I wish I had this tool. I mean, I've used it on you, I think, since then. 6 years ago, I didn't have this, but we started out by identifying, do you in fact have disease, arterial disease, which is easy to find with a carotid ultrasound with this technology I've had for about 3 years now. And so we've been measuring the age of your arteries, which we use the term arterial age as a way of helping people understand that the more inflamed your arteries are, the older they get, and the closer you get to an event, a stroke or a heart attack being the most kind of noticeable. But even if you're rescued and end up with a stent or surgery, they tend to be life altering. So my goal has been to uh, include you in our, I guess I'll call it the club of zeros, because in 10 years, 0 of our patients have suffered a stroke or a heart attack. And I certainly don't want you to be the first. So I want to help you stay on track. And so far, so good.
Yes, yes. But I would also say this is that I found that my head's kind of hard. It's hard to get out of old habits, and you've been talking to me for a long time. And I I was listening to you, and you were saying, Tony, I think this is the kind of path you should take, and I think these are things that you need to heal. And I think that at the very, very beginning of it, I was like most people, I think, is that, oh, well, I think that I can walk the path as much as I want to, and then I'll get the full 100% results. But you don't ever. That's not really true, because I'm actually fooling myself. And so my path and my journey with you has always been. You said you always look at the signs, symptoms, the tests that you've run, and you've always said these are the things we need to pinpoint in order to get this taken care of. And so as I say, with a journey, you can take your supplements, you can take this, you can take whatever that is that you prescribe for us. But I do believe that the thing that is most important is that we have to figure out if this is really important to us as it is to our doctor. And I find that sometimes we think it's important to us, but it is not as important to us until we have that epiphany that says, you know what, my doctor's been telling me, hey, it's about time to get on this bandwagon. And it took me a few years for you constantly telling me, Tony, these are the things that you need to be working on. These are the signs that we're trying to heal. So what are you going to do? And I usually leave your office and tell you, so, hey, doc, I'm going to get right on that. Well, old habits are hard to break. And as I find that once we become serious about and start listening and start following the path that you've given to us, because, this is my experience with you, this has been for a number of years. And your conversations never change, even though my mindset finally changed, And when your mindset changes and you say, okay, listen, I'm 70, I'll be 72 this year. My doctor's health seems, my health seems to be more important to my doctor than it does me. And I see all these other people having all of these that are my age having these maladies that sometimes they're not able even to correct. And I asked them, I said, well, why do you have that? And they can't even give me an answer why they have it. Well, I know when I come to you, you say, well, these are the signs that tell you why this particular thing's happening to you. And this particular year is one of those times, the epiphany year for me, is that you hinted, said, hey, Tony, you know what? It'd be nice if you get your weight down to a point that we can start really working on this. And, the whole weight thing is if it's not important to you, it can be as important to your doctor as it wants to be. But until you have that, focus, which happened to me in July, I finally got focused. And so when you saw me, I've actually, from July to this point, lost about 51 pounds altogether. So, and my signs that you have always been talking about, those markers are starting to change for the positive. And in some cases, as you say, have changed real well. But does that mean that we're finished? No.
Well, we're always a work in progress. I always say that, how many doctors does it take to change a light bulb, or for that matter, principals or correct, leaders? And the answer is only one, but first the light bulb has to be ready to change.
Right.
And I think the one of the things that I would say has been a bit of a journey for me and I use the term coaching. In fact, that's the app that we use is called the Cure Coach app. And it's about, identifying opportunities for improvement, giving you the tools to execute that improvement. But it's your plan. It's your game plan or your cure plan, not mine. But I've learned over time that not to take it personally when things don't turn around 180 degrees. And I've learned that people, there's a few people out there who and usually after a very serious epiphany, a heart attack, a near-death experience, or maybe a close relative that has had that happen, that you'll see that happen. But for the most part, it's a series of nudges. You make a course a change, and then you assess, and make a change, you assess, and we all have slips, and we get off. And I'm a human being too. I have to tell myself, I got to lead by example. So we all slip up, and the key thing is to recognize that it's going to happen and get back on track. I wonder if you would mind. I'd love to show your InBody trends recently, because in our last visit, I think when I first saw you, I said, "Who are you, and what have you done with the rest of Tony?" Because you had lost significant amount of weight. But I think for the audience, it'd be maybe a little bit helpful to see the kind of information that you get to see. Is that all right?
Yes, yes, yes.
Okay. So I'm just going to pull up here. So this is from a device, body composition analysis, and we affectionately call it the Judge. And as you can see, Tony's had a reduction in his weight, but what's really helpful is that it's a big reduction in his body fat, and he's actually gained some muscle mass recently. So his percent body fat has gone down. And this, I think, is one of the most important markers or indicators of health that you can have, is how much of you is, I'm sorry, I have to use the F word, fat, and how much of you is muscle and bone and lean. And the leaner we can be, the better. And our definition of healthy weight, I think, has really been quite distorted by our culture. I mean, we have normalized being overweight to the point now where obesity, or even morbid obesity, has become the norm. And we've got some real soul searching to do as a culture, to recognize that. And everything in our media drives us toward, I call them the bad S's, the sweets and the starches and the snacks and the sitting, all these things that we have, quote unquote, have control over, but unfortunately often they tend to have control over us. But you've done a very nice job recently to get more control over that. And we tried to give you the information, the feedback, to help reinforce it. Hey, it really is working, and it's to your benefit. And also at the same time, I could show that your arteries have over time become younger and less inflamed, and therefore I worry less about you waking up and or suffering an event. Arterial disease it's slowly progressive, then it suddenly results in an event, and that's what's tricky about it. And that's why I'm a strong proponent of early detection, screening, if you will. Medicare and payers don't pay for our ultrasound screening, but we keep it affordable, so we don't really have to depend on others to pay for it. And then the subsequent treatment, because we have a diagnosis, is covered by your insurance. So I hope it's been affordable enough for you. I think you're
Yes,
you're definitely
yes.
worth it, whatever the cost, but we try to make it affordable and accessible.
You were talking about how our culture has changed. I have a number of friends. I mean, it's almost an epidemic, and it's I would say in the 60s to 70s that these TIAs are commonplace. And I asked them, I said, well, okay, you had a stroke. They say them are small strokes. So why did you have this? Well, they gave me medicine. They didn't really tell me why I had them. I said, well, how do you know what the cause of it is? I mean, is the cause of it is your cholesterol? Is it do you have narrowing? What is that? And it's really crazy, because the majority of them have no idea why they had it. All they were given was medication. I have a track record because of you being able to see what's going on with me. And until a person, I know that you don't give medicine just because without having a reason. And supplements is your biggest tool. So when I look at my friends and they have 5 or 6 different kinds of medicines they were given in order to take care of a problem, and I asked them, I said, well, why in the world do you have to take this? Well, I was just told to take it. I said, do you know why? And they, no. And but that comes also with side effects. And the side effects, I heard a doctor, one of my friends said, well, the doctor said the side effects are less than the potential of me having bad health. And I was like, oh, okay. So I kind of left that alone.
Well, my approach is I call it the 3 legs to the stool. There's lifestyle, which is nutrition, exercise, avoiding things that are toxic to us. Uh, Targeted supplements. So if you're not vitamin D deficient, or optimized, there's no need to take a vitamin D supplement. Unfortunately, most of us are deficient in vitamin D, which is extremely harmful to us from an immunologic point of view, risk of cancer and risk of diabetes. But that's just one example. And then, medications when the risk is worth, or when the benefit is greater than the risk, and the other measures haven't produced the kind of results that we would like. But, we never just, cover over a symptom or a measure without trying to understand what's causing that problem in the first place. And what I just want to point out for those that are not aware, there's a lot of, we call them root causes, that are not widely, at least investigated. There's a lot, I would say there's kind of a subtle awareness. Like, for instance, it's more and more common for me to say, that your oral health, the condition of your gums, inflammation in your mouth, airway issues is an unrecognized cause of heart attack and stroke. Yeah, I've heard that, but are you doing anything about it? Well, no. I mean, we actually pay very close attention to that, and enlist your dentist and your hygienist in part of your treatment. So there are things that get overlooked. Lipoprotein A, for example, vitamin D, homocysteine. There's a number of things that we do look at that are just kind of glossed over, and part of it is that the mainstream healthcare providers are unaware. We aren't taught much about nutrition. I learned a lot more about it 10 years ago, although we try to keep it simple. I call it, again, the sweet starches and snacks. It's really, they're far more potentially lethal than cholesterol, for instance, or even fat, for that matter. So, but I think you at least were open-minded and coachable, which I think is the key characteristic to be successful in our program. I noticed that my video is freezing up. I don't know if my audio is freezing too, or
no, it's just
okay.
Just your video.
Okay, so hopefully it'll figure itself out here in a minute, and I won't be there with that silly look on my face. Excuse me, sillier than usual look on my face. So just to kind of wrap things up, if you were talking to a friend or an acquaintance or somebody that you were encouraging them to come talk to me, what would you want to say to them?
I would say go with a do mentality. Listen to what you're telling. Look at the path that you're setting for them, as far as healing their whatever that is in their bodies that needs to be healed or restored. I think that's the thing, because sometimes our cells, as I understand, may be damaged, and when we do things that are positive, that starts healing those original cells. So I would tell my friends that you have a lot of tools that they would not normally see if, in fact, they went to a doctor, and just ask you about them and follow the guidelines that you give them. I'd also say that you have to be ready. You can waste a lot of time not being focused. So I would just say, hey, be ready. If you're going to do it, do it. Don't waste a lot of time by listening and not doing. And the benefits that you get from listening to you and the information that you get is, my goodness, when I take your information and I share it with other doctors, they're like, well, he's got all this. I go, yeah, that's the kind of information I get. And they always ask, is it a way that I can get the information that Dr. Bax has done for you? And I said, well, he will readily share that with you. Just let me know how I'm going to do it, how to get those results to you. And as you know, this last time you faxed them to my doctor. As a matter of fact, he called me today and said, hey, I just want to let you know I got the results of the test and everything. I'd like to sit down and talk to you about some of them. They look really good, and that's worth its weight in gold. Knowing actually what's going on with your body instead of just guessing, and also having my primary care physician being very open to listen, because sometimes, as I've seen, doctors don't want to listen unless they're the ones that do the diagnosis. But my primary care doctor is very open to that. He's a young guy, and so he called me just today and said, hey, I got your information, and in August I'd like to see you. So there's where I'm at. And I thank you, Doc. Like I said, you've always been there. It was me that had to decide what was important, and now health is important. You should have always been.
Well, I appreciate the fact it's a good situation you find yourself in. You're very coachable. We have a lot of new information to offer you, and the rest of your healthcare team is open-minded and willing to admit that we don't know everything. I think that's the and I certainly don't know. I continue to learn, and I learn from my patients, about how to approach things and new information. We always have to be ready to incorporate and learn new things.
Well,
Tony, it's always a pleasure.
I just want to tell you thank you for all you do, and I look
All
forward
right.
to seeing it.
Thank you.